Some potentially harmful drugs that you can buy at gas stations. Today I'm going to talk about KRATOM. And I've learned recently there's quite a passionate following about KRATOM. And in low doses, maybe it helps people feel some kind of way in a beneficial light. But I don't see those people in the emergency department. So I'm strictly talking about high doses and complications of high doses. Let's take a patient, a young patient, no medications at home. And they only take a ton of KRATOM. It's usually ingested, sometimes in a tea, sometimes snorted. You can hypothetically smoke it, but that inactivates some of the more concerning active compounds. There are some ways to buy smokable vape-type products that are KRATOM, but those are less concerning from what I've seen. High doses of ingested KRATOM in the early phase cause a sympathomimetic response, think cocaine, think methamphetamine. In the later stage, cause an opioid type of toxidrome. Think respiratory depression, think tiny pupils, think sleepy, right? So on a face value, if you have a young patient come in, hype up on something, fighting people, usually they get some kind of antipsychotic or some type of benzo to chill them out, right? Which in the acute phase, sure. But in the later phase, when the more opioid agonist of these alkaloids that are active in KRATOM take over, that could be a problem because you're giving more respiratory depression on an already respiratory depressed state or whatever. So on face value, you have someone come in, they're hyped up on something, they say the word KRATOM. You still might need to give them benzos or antipsychotics, whatever. Just be wary that later on, don't forget about them because they might get sleepier and it's not just because of the med you gave them. The second issue is the receptors that KRATOM acts on aren't just your adrenergics, like cocaine, isn't just your mu opioid agonists, also works on your serotonergic, your dopaminergic receptors, your calcium channels, your norepinephrine, pretty much everything, right? So you're also going to be concerned about, is there serotonin syndrome? Are you going to have an elevated CPK? Is there going to be rhabdo? Are there going to be pro-arrhythmogenic states with the calcium channels? And that's only with one drug at high doses that you can get for $10, $20 at your local gas station. So next time you have that patient on a couple psych meds, a couple blood pressure meds, and the word KRATOM was used, and they are altered, don't just throw benzos at the problem and forget the patient exists until they metabolize to discharge or whatever. Because not only are you doing that patient a disservice, you could be exposing them to additional unnecessary harm.